Hello. I would like to extend a warm welcome to all the journalists who have joined us from around the world today. It is with great pleasure that we welcome you to the second learning expedition of the Future of Health series in partnership with Making More Health. Today, we will focus our discussion on the role of digital technologies in access to healthcare. Guillaume, I don't know if you would like to say a few introduction words.
Hello, you see me? You hear me?
Yes.
Yeah, sorry. So thank you, Theresa. My name is Guillaume Deprey. I am part of the Global Making More Health team. So as Theresa said, welcome to all of you to this second learning expedition. And this second learning expedition is part of a webinar series on health. This session focuses today on the role of digital innovation in securing access to primary healthcare for all. It's a promising topic, I hope, and I'm very curious to know from the speakers today what are the ingredients that are found in a digital strategy to make it work. Spontaneously, I would say, in addition to good techno, trust, I would say link with the community, but let's wait. As I told you, I belong of the Making More Health team. Making More Health is an initiative that focuses on social entrepreneurship launched by Boehringer Ingelheim in 2010 in collaboration with Ashoka. In 10 years, we have built a network of more than 100 social entrepreneurs, and we work closely with them on different innovative projects and also on different co-creation. And to know more about Making More Health and the incredible stories of social entrepreneurs, you have more information on this book. This book is Health Tomorrow, done by Making More Health. But now it's time to listen to Theresa again.
Fantastic. So let's get right into the topic. If any more proof was needed, the COVID-19 pandemic has certainly shown us that digital transformation has become a vital component of healthcare services. But beyond the crisis, we must ask ourselves, can digital technology be the game changer in providing access to primary healthcare for all? So we will have the opportunity to explore the ins and outs of this question with different key health stakeholders through an interview and then a roundtable discussion. But first, I invite our moderator, Jayme Fraser, a reporter specialized in data and working on health issues for USA Today, to share her insights regarding this issue. Jayme, it is an absolute pleasure to count you among us. Thank you for joining us for this important discussion.
Thank you for having me. I always look forward to an opportunity to ask questions and hear from others about their experiences. So, the pandemic has changed life around the world, but in a lot of ways, it's not really changed life as much as it's exposed long-standing issues we've had with healthcare access and inequities in that access. Whether that is structural racism or other barriers that mean some people have less access to testing or quality care than other communities, whether that is, structural issues in the community that result in some groups having more pre-existing conditions than other groups that lead to more severe outcomes. The pandemic has also exposed flaws in our healthcare delivery models that anyone who's been working in this field has known for a long time is there, but the pandemic has just exacerbated, whether that is government-run clinics not being included in early PPE distributions in the US, or also here, hospitals over the last few decades had reduced their capacity to try to increase efficiency and therefore profits, all of which has become problematic when you're dealing with a public health challenge of this scale. We've also seen, debates about personal health as a human right and public health as a community good, who ultimately has the responsibility to respond and protect communities And what kinds of sacrifices are we as individuals expected to make to serve the broader community good? And all of those challenges have forced decisions at, local level in our personal lives, decisions made by doctors, by government officials, about whose life is worth protecting and whose is worth saving. When you have to triage care, does a person with disability have the same innate value as someone else? In the way that we triage, the answer is no. And that's a moral and ethical question we're all being confronted with today, but has existed in our healthcare system before the pandemic, even if it's not been as broadly discussed. But I've also seen a lot of resilience from communities, broad community activism and interest in public health that wasn't always there before, but we can tap into. And I think some of the early successes in Africa, for instance, highlight, how having a public health oriented mindset can lead to a quicker response when the next emergency comes along. And there are technological innovations and regulatory changes that have been made to accommodate the response to the coronavirus pandemic that could have long-lasting and widespread benefits for healthcare beyond this incident if they stay in place. So it'll be interesting to see not just how nations and communities respond differently to this pandemic, but what lessons we can take and carry forward to address these long-standing issues.
Thank you, Jayme, for these precious elements of contextualization. So before I invite Joost van Engen, a social entrepreneur using digital technology to provide access to medical products and services, to join you on the stage, I suggest we watch a short testimonial video from people on the field sharing their personal experience as beneficiaries of Joost's innovative social enterprise, Healthy Entrepreneurs.
Il y a un système national d'approvisionnement en médicaments ne fonctionne pas bien et on demande au centre de santé de s'approvisionner au niveau des zones de santé. Malheureusement, les CDR ne sont pas opérationnels et les zones de santé manquent de médicaments. Maintenant, les centres de santé sont obligés de chercher les médicaments sur les marchés, partout là où on trouve les médicaments, sans vérifier la qualité. Et il y a des fois où les produits de mauvaise qualité qui peuvent faire à ce que la personne meurt.
Ukitumia ukwenda kukamata dawa mbali na ule mgonjwa ulimwacha ku dispensaire, utakuwa kurudia utakutana mgonjwa safari yake ilishaenda.
Mbele farmasia ya kuwa hapa tulikuwa tunaingia ku dispen. Kama vinashindikana ku dispen, wana transfere mu general hapa formula kijun. Hakuna ingine general na kwa huko. Mbele atu yapata hapo.
Madawa tunapata kwa magumu, kwa kupata maserumu kwanza hii ya kusupervise bati ya kolera. Ilikuwa magumu zaidi sana.
All right, I now invite Making More Health Fellow Joost van Engen, the founder of Healthy Entrepreneurs, to join the stage for an interview with Jayme Fraser. Joost will be answering questions following the interview, so please share any questions you may have in the Q&A chat section on your screen. Jayme and Joost, the floor is yours.
Thank you, Theresa. Joost, before founding this venture, you had a very different job in the business world. I was hoping you could tell us about that and what you learned about how to distribute medicines to rural communities.
Well, thank you very much. Well, my name is Joost. I actually have a master in business administration. And after I finished my master, I got a very excellent job because I've been selling spam all over the world. Canned meat, bringing meat to more than 150 countries globally, mainly developing countries, mainly tropical islands where this fantastic, tasteful product was actually consumed. So during 5 years, I learned how to run business, how to build up supply chains reaching the very last mile. After that, I've been working for 7 years in the distribution of essential white label medicines through a Dutch organization, mainly supplying international NGOs like Red Cross, Doctors Without Borders, and USAID-funded projects, and at the same time, the so-called central medical stores. And while doing that for 7 years, as being the sales and marketing director of the company, I learned that I was able to get spam distributed everywhere, and those essential products did not reach the final customers. And that's where I, 8 years ago, decided to give it a try to find alternatives way to get into last mile service delivery of both products and services in remote areas all over the African continent.
And what was the disconnect? Why could you get spam to remote areas and right to the customer, but not essential medicines?
Spam, like Coca-Cola and beers from Heineken and other brands, are distributed through the private markets. When you get into the sector of providing primary healthcare, the majority is organized as part of the public health system, where according to a treaty decided in 1989 in Bamako, we have decided that this should be a public system that actually should be organized by the government, together with the support of NGOs, providing those healthcare services for free. And it's my clear opinion that the size of the market and the market needs are not able to be served properly using public means only. And therefore, I'm very much convinced that a private sector intervention is actually needed to actually make the public system work proper.
And so what are the advantages you have running as a business instead of as a philanthropic model?
I think there's two key differences. When you talk about an NGO, when you talk about projects that are funded, they are known to have a beginning and an end. They have a very clear target, they have a very clear scope of work where they will temporarily operate. Well, when you're operating a business, you're talking about a long-term commitment, you talk about customers, you talk about a supply chain, you talk about a model where everyone who is in the chain has an ongoing continuous interest. And when you talk about that interest, you're able to also access investment money. And actually, that's where the key is, because we need much more money to reach 600 million people living in sub-Saharan Africa at the last mile. And that's today. And in 10 years from now, by 2030, we will have more than 1 billion people living in the same circumstances. They all need to be served. There is no donor money. There is no funding money available to all serve all those people. So we need to have alternative solutions. That's where the business comes in.
So when we talked initially, you mentioned 3 keys of success: capital, efficiency, and scale. Can you talk about how technology has helped you achieve capital, efficiency, and scale?
Of course. Well, we are operating as healthy entrepreneurs in the very last mile. So we are only operating in those areas, providing community health entrepreneurs an opportunity to become an entrepreneur. And while becoming an entrepreneur, they start to become the first level of entrance for healthcare provision. And so we provide them every 2 weeks access to a basket of products they can buy. And at the same time, they are trained by us, having a doctor at a distance that provides them additional access to information they need. They also have a tablet where actually you see a picture of now, where we have in local languages, 9 languages in total, 125 movies, educational movies about healthcare. We have information flows they can go through by pushing buttons and getting the right advice, whether the people should do nothing, whether people should get some basic treatment, or whether people should be referred to a nearby health facility, which is at least 5-kilometer walking distance. So what we also do, we organize the supply chain. And this is also where technology comes in, because our entrepreneurs, you can see here on this motorbike, with their orders just bought, they have ordered through our apps. Those are apps where we can use mobile money payments, where they can order, they can see the stock position, it calculates automatically what's the price to be paid, and we will deliver them within a few days, according to our delivery scheme. And then we also have, using technology to empower the position of our entrepreneurs in the remote areas, access to a doctor, where they can do some screening of vitals on the spot, and then sharing the information in a smartphone, and sharing this information through the smartphone, through the 4G network, to our doctor at a distance, who will then prescribe and send back the prescription of a number of cases where access to a health center is now needed, and therefore bringing us more value-added services in the rural communities. And that's in the end what healthy entrepreneurs is about. We are using an existing platform which is called community health workers, which exists for ages, which has never been sustainable to make those people, mainly women, being independent, having a duplication of their income, and at the same time increasing the services they can offer. First, only at the primary healthcare, very basic, and now we have a virtual health center where they can also access nurses, they can access clinical doctors and medical doctors. And so for a lot of cases, there is no need to travel. And imagine, in case people don't have to travel, living in the most remote area, they're able to save more than 55% of their expenses out of pocket for basic healthcare. So by bringing the healthcare closer to them, we actually make access to healthcare better. But at the same time, we also offer them a significant saving. 55% of their expenditure on healthcare, but in total 8% of their monthly expenditure they just can reduce by having access to healthcare better. And that's all because of technology. Because without technology, we're not able to operate. Technology also helps us to operate at scale. We have at the moment more than 6,000 entrepreneurs active, and in Uganda only 3,500 today. And in 3 years from now, we expect to have more than 20,000 active, serving all remote areas of the whole country at scale, having incentives for everyone in the chain, and having a complete quality controlled system, all driven by technology.
So that sounds very impressive, but where did you start and what were some of the challenges in building this technological infrastructure, both with tools that already existed and in building new tools that actually served the communities you were working in?
Well, very good question. Thanks so much. I think the challenges have been significant, especially in the beginning of the Healthy Entrepreneurs by 2012, which is only 8 years ago, but by then technology was not available in the way it's available today. We have been carrying servers under our arm in the aircraft, bring it into our offices by then. And so we were accessing it very difficultly, registering only transactions on the spot. We first were looking for apps that we could use, and we had to build them all ourselves, because one precondition is that they all work fully offline, and that was not available. There was no builder. So we found them, we built our first generation of apps, and they've been very effective. And at the same time, we also learned that we made mistakes in the design. So together with our customers, we kept on developing, and we are now having the third generation of apps based on an existing platform that makes it much more maintainable. The same applies for the ERP systems we are using today, which are part of a platform and therefore doable. So technology developed a lot. At the same time, for us to really get connection with our customers, we know exactly what we need to do. And so the communication to our customers remains the same, but the back end has changed significantly and made our life much easier.
And what you talked about some of the challenges and having to adapt the system to actually serve the entrepreneurs and the customers. How do you design a feedback loop so that the technology you bring actually serves the people you're working with?
Feedback loops is actually, there's multiple ways doing so. We have, of course, our people who are actually in touch with our entrepreneurs. So we have like, we call them like sales officers or communication officers with our entrepreneurs who will get a lot of feedback themselves. So there is a very direct interaction while using a phone. Secondly, we of course have a lot of data, user data of how apps are used, and so we are continuously evaluating if the information and everything we are providing, all the information flows are properly used. And we also do like feedback sessions on a regular basis with like focus groups to make sure we keep on improving our services. We are a business. We only want to make sure that our customers are actually motivated and actually served well. And so for us, the opinion of our customers are key. And that's actually what makes us continuing growing, developing, further developing. And now for 8 years, I'm very impressed by what we have achieved so far, especially now also bringing in the telehealth solution, because that's actually magic. What we found in Canada, in Australia, for years, there were people offered telehealth services at a distance, people living far away and not having access to a doctor. And in fact, in Africa and remote areas, it's the same. But there's never been anyone who has translated this technology into Africa. And it's actually accessible. The technology exists and we can implement it on the local circumstances with using the local terms and rates, making sure that we have nurses and doctors who are not willing to live in those remote areas, still bringing a lot of quality services close to people, for both infectious diseases, but now also for non-communicable diseases like hypertension and diabetes. It becomes a key part of our business. And thanks to that, thanks to COVID, actually, we found solutions where We started the innovation already using telehealth, but for COVID, in our response, we have been able to serve so many people with consultations, with advice, and actually escalating them to the necessary service providers in case of any concern. So it's a movement, and we are definitely part of it, and we are aiming to make this an ongoing revolution. Let's say it like that.
Thank you, Florian.
Thank you, Joost. Hi, Jayme. Hi, everyone. So I'm working with Theresa from Sparknews, and I'm managing the chat. And we actually have a few questions coming from all participants. One coming from Ruggiero from Italy, who's asking you, Joost, increasing and improving digital patient engagement is considered one of the biggest challenge in any healthcare organization and in its path to digitization. So how do you think this could be achieved?
The interesting thing in our case with our customers, and really imagine those people are living very far away, are not so much used to anything. So on the one hand, it's very difficult to get access to them. At the same time, for them, the opinion of an expert counts very much. And so for them, if they even travel to a health facility, in many cases, they don't know exactly who to talk with, what kind of service provision they expect. So the moment they get used to the fact that they can call someone, because in the end, we are using a call center to actually have connection. So there is no video conversation whatsoever, but they have a trusted partner in their community, who is the selected community health worker, on top of a nurse and or a medical doctor that provides information, and we are continuously available in their community. We are able to break through their reluctance to work with us. And they, over time, get convinced that we are not one of those temporary projects that actually doesn't add real value. No, we are there forever. We are part of them. And so that's where the trust appears. And that's also where the acceptance of technology comes in, especially since we train our community health entrepreneurs very well.
Thank you, Joost. I actually had another question for you. I wanted, like, the health market, if I may say, is pretty enormous. And in this context, what do you think is the added value of a social entrepreneur as opposed to a regular one, if I may say?
I think it's very interesting. Good question again, thanks. Imagine we are serving a market which on sub-Saharan Africa represents 600 million people, or 120 million families, who are all on average spend $100 a year on basic health. So there is an existing market in the remote areas of 12 billion, poorly spent, out of which 55% are actually transport costs to acquire healthcare. So there is a market out there. At the same time, if I see the regular companies operating in Uganda or Kenya or Tanzania, they mainly focus on urban, peri-urban areas because there's a lot of population, there's a lot of market there. And they are actually not having a proper answer to get into this last mile. At the same time, they are so busy serving the other part of the market, which is a challenge on its own, that they are actually earning enough and they are not so much motivated getting there. And that's from that perspective. Our key suppliers in the Eastern African region are actually players who could be our competitors, but they are not, because they appreciate our value add to the market. We are serving part of the market they are not able to. And so they appreciate, give us the best prices, and they will reserve any scarce stock for us because they know we are complementary to them. So we are, as a social enterprise, complementary, building the showcase, making sure that we are, as an investable company, for profit, probably to be sold one day, I don't know, but we showcase in multiple countries that we are able to do this at scale, long-term standing, and that's where I believe, well, that drives me to make sure that we are able to. And I hope that we will be copied in many cases and other people will do the same, because this is a market that actually, when it's properly developed, will certainly contribute significantly to the Sustainable Development Goals by 2030.
Thank you. I wish we had more time to hear about your work with healthy entrepreneurs, but we need to keep things moving to make sure we have time for all our great speakers today. The Sparknews team will share, I'm not sure if it's your email address or one of your colleagues' email addresses in the chat, in case anyone connected would like to get in touch to learn more about Joost's work. Joost, thank you very much for joining us today. It has been a pleasure. Moving on, I invite our 3 roundtable participants to join Jayme Fraser on the stage. Bernardo Mariano Jr., Chief Information Officer and Director of Digital Health and Innovation at the World Health Organization. Spring Gombe, Program Manager at the United Nations Technology Bank for the Least Developed Countries, and Franck Baudino, founder of the innovative French enterprise specializing in telemedicine H4D. Once again, we will be taking questions following the discussion, so please share any questions you might have in the Q&A chat section on your screen.
And everyone's here. Thank you for joining us today. I wanted to start with a basic question, but could each of you please share a recent example from your work about how you've seen technology used to improve access? And we'll go ahead and start with Bernardo.
Thank you. I hope you can hear me.
Absolutely.
Can you hear me?
Yes.
Good. Yes, I think, at the World Health Organization, let me say that prior to the pandemic, we had our digital roadmap and whole strategy. But when the pandemic was declared, and we realized that the systems that we have, the solutions that we have some needed scale up, but others needed innovation, completely new systems. And we reached out to the private sector. And actually, I have to say that traditionally WHO is we're not very good at dealing directly with the private sector in a partnership model. We deal with private sector on a contractual model where we buy something and they sell us something, right? But for the pandemic, we were very positively surprised by the engagement from the tech companies that supported us to really ramp up our capability, our digital capability, to really respond to the pandemic, both enhancing systems, but also creating new digital solutions. But internally, we had also to ramp up to address emerging challenges that the countries had: contact tracing, proximity tracing, the issues around ethics and privacy around the contact tracing solution. So we had to issue some guidances around that. So I have to say that while we all face difficulties in the pandemic, this pandemic has been one of the catalytic forces to accelerate the digital transformation, and we hope to see that continuing and respecting all the ethical and privacy considerations.
And Spring, what about you? What's an example of a recent technology used from your work that improved access?
I suppose it doesn't seem... I hope you can hear me.
There we go, much better.
Okay, there. I always forget. So it may not seem like a very obvious thing, but it's actually quite related to the work that WHO is doing. One of the projects that we host at the Technology Bank is called the Tech Access Partnership, which is a joint UN initiative to respond very rapidly to the lack of equitable access to COVID-19 technologies that developing countries, and especially the least developed countries, are faced with. And as you know, as the pandemic evolved, it became very clear that there was a need for guidance on what kind of masks people in the community could produce, what kind of masks companies could produce, and how tech companies could pivot their existing manufacturing capacity to respond to COVID-19. And funnily enough, this was really expedited by our being forced to engage with each other using digital platforms, right? Communicating over Zoom, but also communicating complex information. Here are technical specifications coming to you, textile manufacturer in Lesotho, from a technology holder in Thailand or in Turkey. And all of this is being facilitated by us, and we're providing guidance using digital technologies. And though none of us have had contact in the usual way that we would have to afford technology transfer, we're actually making it happen. And digital technology made that possible. And in a way, concentrated minds, you have a 1-hour Zoom meeting to get the information across and to get things done. You do it and you follow up very quickly using technologies that may seem obvious to us now, but this would have been impossible 10 years ago, indeed is still impossible for some of the people who were mentioned in your video before. You know, I grew up in Kenya. It was the reality that if somebody called you from a rural area with someone with malaria, by the time you figured out how to get money to them to get the malaria medication, that person may have died. These days, you pick up your phone and you send M-Pesa and they have it in 10 minutes and they can buy the medicine and take care of a person who needs it urgently. So there's huge potential in digital technology and we've been exploiting it.
And finally to you, Franck, can you talk about a recent example from your work and how technology solved a problem for healthcare access?
Yes, sure. First of all, hello, everybody. I'm very happy to be here with you today. Maybe in few words, just to tell you what we do at H4D. I'm a medical doctor and I worked in different countries in Africa and in Asia. And I've invented the first connected medical office, which is a kind of medical booth, fully equipped. And the remote physician is able to do a real medical examination. There is a stethoscope, skin camera, ENT camera, etc., etc. So during this crisis, in few days, we were able to implement this solution in small villages, even in France, but also in 5 other countries. And I don't know if you remember, but even in Europe, people were very afraid to consult their own physician because they were afraid to be contaminated in the waiting room. So a lot of physicians and patients use this technology to be able to follow up the chronic disease, for example, or to treat people. So the first example I can give you, it's when we implemented this consult station in small villages, in those villages. So thousands and thousands of people used this telehealth solution to be treated. And for physicians, it was easier to follow up the patients. The second example I could give you, it's we implement also this technology in another mode of use, because this medical booth can be used in 2 different modes of use. The second is not in live teleconsultation, but it's a checkup mode. And we implemented this consultation into the hospital to create a new way of a new pathway for people who are suspected to be COVID-19 positive. So it was very useful for the treatment and the triage of those people, even in emergency room. So it was super concrete.
So can each of you talk a little bit about, what are the opportunities we have for technology in improving healthcare access? I'm particularly interested in, is it simply adapting existing technologies for new communities that haven't had that infrastructure or service before? Or does technology create opportunities to design entirely new systems that we haven't seen yet? Why don't we just go in that same order again? So Bernardo?
Yeah, let me start by saying that let's imagine a world where we have a digital to digital interaction. In a world where actually in some other sectors, such as financial sector, is already happening. So today, if you in the health sector, if you need to see a doctor, you have to physically go to a hospital or medical facility. But we have telemedicine, which is, from the technology perspective, is matured enough to actually deliver more than what is currently delivering. So we need to just strengthen some of the policies and regulations around it to allow a patient sitting in Switzerland, where I'm sitting, and being able to see a doctor virtually that is sitting in Spain, or vice versa. Imagine how much that would extend the capability of health service delivery. Now, in terms of where we could actually gain a lot, it's also in some of the innovative technologies, like the frontier technology. Talk about blockchain. Currently, WHO is working with a number of entities and countries to develop the digital international vaccination certificate. And if you dive deep down into that issue, we don't have today, the only international vaccination certificate is a paper-based. It's for yellow fever. I use that to record all my other immunization. And when I get tetanus or hepatitis B and C vaccine, but we have the tools and the means to actually develop a digital international certificate to allow adults to have a digital card or digital smart card that allow us to actually use that in such a way that we embark into that transformation. So the whole healthcare sector needs to accelerate that transformation. At WHO, we see our role as to support countries to really in that transformation and ensure that we do better than the banking. 10 years ago, banking was going to the branch. Today, you hardly go to the branch. So that is where we want to see healthcare sector to say, if I can have a digital to digital interaction in the health sector, I have that. Of course, once that decision process using AI technology, we can then say, look, from the moment that is not enough, then we transform into physical to physical. But today we just go physical to physical by default. So yes, we have a lot to work, but we are there, and I think we want to see this whole sector transform in much better way than other sectors, that digital transformation of healthcare sector.
And Spring, what do you think? Yeah, is the primary opportunity in extending existing technologies or developing new ones?
Gosh, I think it's mixed, and it's also hard to tell. So I'll give you an example from what we have learned with some of the countries with which we are working. So, for example, the Technology Bank is working with Rwanda, which is a least developed country situated in Central Africa, for those who don't know. And it's a small country, and it has its own ambition, has its own development ambition to improve the way in which it captures the capacity of digital technology to be transformative, right? So when we started working with them, on trying to understand both their technology needs and existing gaps for COVID-19, they had already started doing incredible things with drones and capturing data using drones and transferring data using drones to their health ministries and to their ICT ministry, who are working then together to understand movement of people, which is important in a pandemic, to understand where the most vulnerable were and how to reach them. Then they used robots, which are a different kind of technology, but yes, to safely deliver food to people who needed it, and for cultures that are very for whom community engagement and taking care of the whole extended family is very important. This provided the kind of assurance through the use of new technologies to families that their loved ones were being taken care of, and so they didn't need to move around as much as possible, right? If you had asked us at the Tech Bank what the first steps were and which first technologies we should first deploy to respond to COVID-19, we would not have said drones and robots and capturing information and sharing of data and so on through them. But we've learned from that. So how does that help us looking forward? So for example, keeping with the example of COVID-19, we know that we are producing immense amounts of medical waste as a result of the pandemic, and PPE waste in all countries everywhere. We see masks being thrown around, people dropping them, or we also know that we're producing just volumes of waste that are really difficult to understand how to deal with, right? And so that brings the sanitation sector and the health sector ever closer together. And it is through mapping and capturing of data digitally and of how much waste collects, how and when, that you can improve sanitation services, reduce risks of exposure, understand what kind of logistical capacities you have or may need to develop. There are all these new avenues that are being opened up. And in addition, we are learning that we can't just think about our health service provision from for example, the perspective of delivery of PPE. But when we deliver PPE, we also have to think about how are we producing it? How are we disposing of it? What does that mean? What does that mean for the health sector? What does that mean for other sectors? And what other technologies can be brought to bear here? So the question you ask is simple, but it opens up an entire world for us to think about as professionals in this space.
I was muted. This should work a little bit better now. Franck, your venture blends an old technology with some new innovation. So can you talk about, the opportunities both in extending existing technologies and developing new ones?
Sure. In fact, I think that a lot of things does exist now. We will invent maybe new things for sure. But, if we talk about digital health, if we talk about telemedicine, finally, we don't only talk about technology, we talk about a service. So it's very important to know, to have the knowledge of management projects. If you just put a technology and if you're not involved on the management of a project, if you don't deploy a medical project, the result won't be very good for people because you need to develop a sustainable project every time. Why do I say that? It's because when people talk about telemedicine, digital, they think we just need to put technology. No, we need to train people. We need to train physicians because it's a new way to treat people. It's a new know-how. You need to talk to people differently. Even as a physician, you can't practice on the same way when you're face-to-face with your patients. So it's not about only innovation on technology, it's global innovation on project, on service, on training, and for sure on technology.
And technology is great in the problems it can solve, but a lot of communities don't necessarily have the infrastructure to implement existing tools. They may not have the cellular or internet networks to access services. They may not have the devices. And as Franck pointed out, they may not have the familiarity with devices or other tools. So how do you apply technological solutions in isolated communities or disenfranchised communities that don't have that infrastructure in place already? Bernardo? We'll get to you, I promise.
And that's, I think, the question and actually the raison d'être of many of us, as we want to make sure that we have health for all, meaning all does not exclude anyone. And of course, digital the technologies currently, which rely very much on broadband, and the access to broadband is still just a little above 50%. I think it's 53%. So it's 47% of the world's population still don't have access to broadband. So when we focus on this digital transformation of healthcare sector, we will need to also at the same time work with other partners to ensure to increase the inclusivity access to, because otherwise we kill the divide. But I'm from Mozambique, and actually there's a Mozambican innovator that sent me something which is called Community Tablet, which is basically he takes the tablet in a big van that can be pushed by donkeys and whatnot in the remote areas, and creates that opportunity of a digital interaction at the community level. So there are some innovative solutions for local communities, which I believe those solutions will not come from Silicon Valley. They will come from those local communities. So we need to make sure that these digital technologies is not just about the interesting buzzword such as artificial intelligence or blockchain. It's not just about that. It's about access. It's about inclusivity. It's about gender. I mean, so how can we ensure at the local level we trigger the innovations at local level, which if for somebody sitting in Silicon Valley, that innovation is not innovation because they have access. But somebody sitting in a remote village that doesn't have enough power, there's innovative ways these communities can create and have that to ensure that they enjoy the access to those digital solutions. So we need to tap into those innovations at the very social innovation at community level to ensure that access is guaranteed, it reaches out to those communities as well.
And Spring.
So this will take me fully agreeing with Bernardo, but also taking this a little bit beyond what the bank does in the health sector. We're actually working with innovation hubs in a number of countries to strengthen existing efforts initiated by countries, because it's not like countries are sitting there passively waiting for us to tell them from on high what to do. The whole world recognizes the potential of digital technologies, right? So we're working with them in the health sector and elsewhere to incubate and understand what technologies, as Bernardo says, originate with the people who need them, who need a change, and those are the most effective technologies. And I'll just point out that, we're very used to using mobile banking, but M-Pesa originated in a country in Africa because of the lack of suitable banking for the vast majority of the population. And so the crux of it is to try and find that sweet point between what it is we know from countries that already have a high level of technological exploitation that can be applied and adapted to context elsewhere in the world, and the immense potential that is already resident in people who know what it is that they need, who know where the gaps are in their health systems and elsewhere, and can leverage that accordingly, right? So I don't want to put too fine a point in it, but I think also of my children who, you say they've never seen a technology, but of those of us who have never seen a technology, you'd be surprised who can use it much more quickly and much better, despite their never having had it in their hands before. So I don't think we should come from a position of seeing ourselves as being educators, but equal partners in understanding how technologies are optimally applied. Thanks.
And to you, Franck.
Yes, I do agree with what Bernardo and Spring said, for sure. To be again very concrete, maybe we still have the state-of-the-art technology, but we invented this technology in 2008, and the first implementation was at the border between the Gabon and the Congo. So it was in the forest. Can you imagine that? It was very not easy. But I can't say every time, but you can find solution. For example, 10 years ago, we started to work by satellites. Okay, so that's why I used to say it's a global project. And for me, the most important thing, again, it's not the technology, the infrastructure can be a problem. But if you consider not only the technology, but the global projects, and you take time to train locally people, to work with local people, to work with the government, to have the access, the internet access, you can do a lot of things. Again, I can't say you can do everything because for sure you need the connection, but no, we can do a lot of things.
So I'm going to switch up the order here a bit and have Franck answer this question first. But you talked a little bit about the importance of having that human training and developing systems for the users and practitioners as much as the technological tools. Can you talk about why that's important, why it's important to develop the system and develop the familiarity with the actual tools?
But different things. First thing, I consider that the technology is just a part of the answer. It has to be complementary with what does exist locally or regionally in the country. Second thing, it's a new way to access to health. People need to understand why they can use and how they can use this technology. So you have to train them, you have to explain a lot, And, you know, again, with this example in Gabon, I was so surprised how people were open-minded to use this technology more maybe than in France or in Italy when we started in Europe, because they understood that using this, they could access to a remote physician. And you have to imagine that when you implement this kind of solution, this telemedicine solution, you address new services for people who sometimes have nothing locally. But you have to explain, because sometimes people can be frightening using this technology. And the third thing, you have to explain to physicians also, not only because it's a new way for them to practice, but sometimes they're afraid because they say, okay, people will go there instead of going to my consulting office. And you have to explain it's complementary, is they can use also for themselves and for the patients this technology. So that's why it's a global project you need to build every time.
Spring, can you build on that? You know, what is the importance of the human connections and the trust when you're bringing new technological solutions to the table?
I mean, I think it's, as Franck has said, but it's varied also, right? You have to understand the context in which people live and their needs, their wants, and in a way, think also of the political realities. You know, we are using technologies that collect information about people that can be used or misused in a number of ways. If you come from a context where data about you has been used for oppression or to harass your family or to make arbitrary arrests, whoever comes into your community, your initial reaction is going to be one of distrust, right? And so that's the importance of having a community health interface, right? Someone who is from there, who understands you, who understands your needs, and who understands the context in which you live, to help build a technology that actually responds to you. And then, like Franck says, there are all kinds of interests. Every party in a project has an interest, and you have to know what that interest is if you're going to address it appropriately. It may be the physician who thinks people will no longer come to my practice. It may be someone who thinks, oh, I can accumulate a lot of power in my community through doing this. I want to become a gatekeeper and become a gatekeeper in a way that can make them a bottleneck. So there's so many issues that you have to think about. And while I'm very confident, and Bernardo knows better than I, that artificial intelligence will one day get us there, I still don't think it is yet at the point where it replaces the human need for human interaction and all those millions of messages that we get through just looking at each other, interacting with each other as human beings.
Bernardo, can you talk a little bit about the importance of the humans in all of the technology?
Yes, sir. So, I mean, I agree with Spring and what Franck said, and I just want to outline or remind, I mean, all of us to two things, right? One is that people should be at the center of all this digital transformation, because if they are not at the center of it, the rate of success will be low and the rate of failure will be high. But also, as Spring mentioned, trust is key. I mean, the digital ecosystem needs to be trusted by every stakeholder in that ecosystem. Otherwise, we will create a situation where we solve one problem, we create another one. And we do have a problem now, infodemics. Okay, we have a people-centered media, which is the social media, but then we have infodemics as a huge problem where now WHO, as we were when the pandemic was declared, and the whole team fighting on the epidemiological side, there's the other team fighting on infodemic side, because it's as damaging as the damage that on the biological side, right? So therefore, I think it's important that the systems and solutions and digital solutions they put people at a center. And the WHO, we did, our member states actually approved the global strategy on digital health last month in November. And one of the strategic objectives is people at the center, because that's the only way we can really succeed in transforming better than many other digital transformations in an area that is very crucial to all of us without exception. Health is crucial to everyone. So we need and we have to do better than we are doing in education, in finance. We owe that to the society, because if we bring a substandard solution that creates this, solve one problem, it creates another one. Actually, the question is, how could we do better in finance and do worse on health when health is so crucial? Because without it, you cannot even have finance, right? So, but also let's recognize the two worlds on digital and health with the two different traditions. There's a tradition of donation. I donate blood. People donate organs. And then the tradition of monetization of data and on the tech side. So those are two worlds coming together with two different principles. But we want to extract the best out of each. Fast speed from the tech, but also precision and accuracy, efficacy, and on the health side, because we do not want solutions that do harm. And if we are not careful, those can come across, especially when we do not put people at the center.
So one last question that's coming from the community that's watching, but you talked a little bit about trust and privacy and the local context, Spring. But how do you address the risks of data breach and technology in the healthcare system, and designing technologies that protect that private information but still include enough information to be useful to the providers? Spring, do you want to take that one first?
Gosh, nice one for me to take first. That's a really hard question. And I think probably Franck, as a physician, will have more to say on this. I think at root, we have to approach this sector from an ethical perspective and have deep bioethical training anchored in all of the people who are involved in the system. Right. And so that's not just the physicians who are providing care, who already receive some training in that and who already apply that, or nurses and so on, the direct health workers, but all of those who are now implicated in the kinds of services that will be applied to health through technology. So it starts with early training, right? Are we training people who work in development of technologies for any sector in ethical approaches? Are we doing it well? Are we doing it enough? I think that's one question that we have to ask. The other is we are going to have to come up with truly responsive understanding of what this mass and rapid accumulation of data and knowledge can mean for health providers, right? So not just that they're trained in health ethics, but they can understand the other side. They can understand the technological side and the potential that it contains, but also understand its limitations. And I think we don't train health people in technology either. So there needs to be a reform of both sides of the training so that people can understand and help each other identify questions that may arise for each side. And that's not going to be achieved by just, one class in ethics for ICT people, or here is a smartphone for health service providers. It's got to be more ingrained than that. This is a personal opinion, but I hope it's validated through the discussion.
Franck, did you want to jump on that one?
Yes. Maybe one very important point. We talk about medicine. We don't talk about wellness. it means that the regulation is not the same. And today, in almost every country, you can't do whatever you want. So you have special regulation when you build, for example, a device for medicine. It's a medical device, so you have specific regulation, and you have to you need to have the highest protection for data and for your patients. To develop one device, it takes between 4 to 6 years. It's super important to understand this. Today there is a big problem because you think that you can use whatever you want, you can buy a lot of different sensors, but most of the time they are not built to be used in medicine. Okay, and the difference is huge. When you use a medical device to provide healthcare, to provide treatment, even remotely, the patient are protected, but also the physician, the insurance of the physician can be acted. So, and it's two different worlds. So it was my first point. So when you work on medicine, if you work with professionals, you have all the security today. So the communication is super important because people will trust you if you explain that you use the right technology for them.
Great. Bernardo, did you have any brief comments on this question of privacy and technology before I hand it back to Theresa?
I mean, just to say that, I mean, from a WHO perspective, we issue some guidance on ethics and privacy using artificial intelligence or other frontier technologies to make sure that as we roll them out, they come out with the privacy ethical principles in mind. But I wanted to pick what Spring said about this on the education side. I hope to see degrees in universities that are medicine and technology at the same time, because today physicians, they have to do medicine 5 years or 6 years and do technology or in another 3 years, and what I hope that with today's situation, we can see Franck.
Oh no, we must have lost Bernardo. But we could hear what he was going for, urging not just for medicine and technology to collaborate after the fact, but to merge the fields from the very beginning of training. Theresa, do you want to take it over?
Sure. Well, thank you so much, Jayme, for moderating this extremely interesting conversation. And thank you very much to all of our roundtable participants, even though we've now lost one. But it was really an honor to count you among us for this conversation. So thank you for taking part in the conversation. As we can see, digital technology is a powerful tool to improve access to healthcare, but there is still no silver bullet. Digital health innovations must be strategically thought out to implicate the communities they serve, as well as the local partners and governments in that region to fit their unique needs and limitations. Digital innovations require a holistic innovation strategy, which requires training people on how to utilize these technologies and also assuring the physical access to these tech innovations and the infrastructure needed to use them at the community level to make sure that they are inclusive and accessible. It is crucial to engage and build trust also with the stakeholders involved to make sure that these innovations are sustainable in the long term. So yes, to all of you connected and listening, remember that these are all important elements to keep in mind when covering the latest innovations in health beyond the promise of pure innovation for itself.
Yes, just a few words to add, but after your conclusion, it's difficult. But just also to say a great thank you to Jayme for a great moderation. It was, for me, a very inspiring session. I would like also to thank Spring, Franck, Bernardo, and Joost for this contribution to this second digital learning. What are just a few words about what I learned? I would say just few words, because you say a lot just before me. I would say digital is great, but without people, there is less interest. So people have to be in the center, and we need, for example, to create a community of entrepreneurs. We have to train people, we have to train physicians, and very, very importantly, we have to create trust. I would say this is very important word. I would just also say thank you to Sparknews for you did a great job to implement this webinar today. I hope all of you listen, you appreciate the debate, and now it's time for you, Theresa, to end this excellent webinar.
I think you have said everything, and we are already 8 minutes over the time. So thank you to everyone who connected today, and we look forward to seeing you for the next webinar in our series.